definitely a flight to quality in terms of life science users wanting to be closer to the core and closer to some of those quality products. And now we've come down to a more normalized level of tenant demand. We are dealing with a market where there's additional sublease supply right now. There are several new entrants, ownership entrants, that have come into the market to deliver products. So we've got about 17 million square feet of operating life science product across all of the core markets. And over 5.5 million square feet of that is in the Cambridge and Boston region. We've seen a shift in lab requirements towards more biology-based users, and that's a shift that's been happening for some time now.
Welcome to Boston Real Estate Times. Our guest today is Colleen O'Connor. She is Vice President of Leasing for East Coast and UK for BioMed Realty. Colleen, welcome to our show, and thank you very much for your time.
Thanks for having me. I'm excited.
Excellent. So now let us start our conversation right away. As I'm sure you know, and our viewers and readers know, that Boston has really become the center of universe when it comes to life sciences and biotech industry. And BioMed Realty is a massive player in this Boston, Cambridge, and suburbs. So my question to you is, with your experience, how do you look at the life sciences real estate industry in Boston today and for the next 5 years?
Yeah, that's a great question. So I work on our leasing efforts across the East Coast and UK. So I have the benefit of seeing some of the experiences in the Cambridge, Boston market, and also some experiences in Cambridge, UK as well. But with regards to the current Boston market, I think what we're currently seeing is there's definitely a flight to quality in terms of life science users wanting to be closer to the core and closer to some of those quality products. And naturally, we saw the life science industry receive a significant amount of funding through various sources over the last 5 years or so. So really, there was kind of a spike in terms of life science tenant demand that happened during COVID. And as we may remember, when the pandemic was first hitting, everybody was very curious about what was going to happen generally in the real estate market across lab and across the office sector. What we found in the life science space is, interestingly enough, we had never been busier. So we saw record levels of tenant demand. We saw a significant surge in space needs from occupiers. So we saw that throughout, and now we've come down to a more normalized level of tenant demand, and in fact a bit less. I think what we saw across our Boston market is, with vacancy levels being close to 0% for such a long period of time during that heightened level of demand, there were a number of groups that took excess space. So we are dealing with a market where there's additional sublease supply right now. There are several new entrants, ownership entrants, that have come into the market to deliver product, having seen the positive fundamentals in the life science real estate industry. So we're at a position right now, at the current moment, where you have a more limited amount of tenant demand and a lot of under construction supply. So
now, can you also talk about your portfolio in Greater Boston area, some of the prominent buildings which BioMed Realty owns?
Yeah, so as we think about our platform, Cambridge and Boston region is one of the largest submarkets for BioMed Realty. So we've got about 17 million square feet of operating life science product across all of the core markets. And over 5.5 million square feet of that is in the Cambridge and Boston region. And the way we really look at the industry is we try to go into markets at scale with a portfolio and platform-based approach. We think that this is a real differentiator for the life sciences business specifically. I think, as we all know, the life science business can move quite rapidly, and we like to take a platform-based approach to the life science real estate.
Is there any particular area in life sciences market which is in greater demand today? For example, lab space or office or manufacturing, if you can just talk a little bit about that as well.
Yeah, so we've seen a shift in lab requirements towards more biology-based users, and that's a shift that's been happening for some time now. So the great majority of the users that we tour and are looking at spaces are typically looking for a 60% lab, 40% office footprint. So when you hear folks talk about lab space, a typical floor plate would include about 60% of lab space. That's typically biology space. So as you walk through the lab, you'd see a number of movable lab benches to maximize flexibility. And then you'd see some limited fixed elements in the lab. You might see an area for sinks. You may have some cold storage rooms or specialty lab function areas. And then the remainder of the floor, the remaining 40% or so, is office space. And that office piece is very critical because you may have a scientist that's working in the lab. Lab's not a place where you can bring a coffee in and do a write-up session. You really have to do the lab work in the lab. And then that same scientist would come out into their adjacent office area, do some write-up work, have lunch, have a coffee, because you can't have those two mix. So that's a very typical lab floor plate that you would see today. In addition to those biology-based lab requirements, there is also a need for manufacturing space, in that we've seen that settle further out from the core. I think there's a couple of reasons for that. Obviously, the cost basis of being right in the heart of an urban environment is significantly more expensive than being further out into a more suburban region. And oftentimes the manufacturing facilities from a development perspective makes more sense to be a standalone building that's a little bit further out from the urban core. And the talent base is quite different. So you might be looking for MIT educated scientific talent to feed your research lab, but the manufacturing talent base doesn't necessarily have to have an advanced degree. And so there's naturally a movement for some of that manufacturing space that supports the critical life science work, but it's just a bit further out from the core.
So of a 5 million square feet, BioMed has here life sciences related space. How much is that in office and lab? How will you distribute that?
Yeah, so the great majority of our product is lab buildings. We do have a couple office only project, but it's pretty limited. So I'd say over 85% of what we've got is truly lab buildings. I think what's happened for us over time is because our real estate holdings are so centered in Kendall Square region, over time, the highest and best use for those facilities has been lab. So we have had some office projects that we've converted to lab throughout the course of time, just given the market dynamics and where the tenant demand profile has been. But the great majority of our platform is really those lab focused
Then the
facilities.
BioMed Realty must have been doing great, because right now there is a lot of demand for that type of space actually. So
Yeah, so I would say, we've seen a significant amount of lab interest that's remained in the core. So the heart of Kendall Square, we continue to see a lot of activities for the lab users. It has been quieter, as I mentioned before. We typically used to see a tenant demand profile for the urban core of about 2 to 2.5 million square feet in a given year. That shot up to about 4 to 4.5 million square feet during the height of the pandemic, when there was a number of new lab experiments and research being launched, and it has gone back down. So right now we're tracking about 1 million square feet of tenant demand. So it's definitely lower than it's historically been, but we have seen a flight to quality and a flight to the core. So we continue to see pretty strong activity across the Kendall Square portfolio. The other thing I would mention is what we're finding as the market has become more challenging is there's really a broadening of users that are looking for space. And what we try to do at BioMed Realty is service the industry. So we have our leasing transactions that we've done over the past couple of years, over 80% of our leasing transaction volume in a given year is with a tenant that we have a pre-existing relationship with. So a lot of it is moving groups around facilities to meet their needs throughout their life cycle versus, bringing in new tenant base for facilities. So having that portfolio and broad-based approach to life science leasing is a key differentiator in this type of market environment.
So what is a typical profile of a BioMed Realty tenant, like size, who they are?
Yeah, so it's a pretty broad range, actually. We very much believe in helping to build the life science ecosystem. And so we think about that as an ecosystem that supports the early stage growth profile companies, a user that might be 5 or 10,000 square feet of lab space, maybe has landed a Series A round in the 30 million, range, all the way up through to groups like Takeda Pharmaceuticals, who's headquartered in our Kendall Square location. They have facilities. We're building a new facility with them that's 600,000 square feet. So we really do service the broad range of spectrum. I think what we typically look at when we're launching a new project is we have a process we've coined as precision programming. Essentially, we do a deep dive on the market dynamics. We look at things like tenant demand. We look at the fundraising profile for that specific region. We look at the supply pipeline, and we try to bring the market what the market needs at that particular point in time. And so that really kind of helps feed how we think about a new development project. There's certain submarkets where, we would not deliver a build to suit opportunity for a user. We know that it really has to be catered towards a smaller user. And so we're constantly trying to fine tune what submarkets and what regions demand a certain type of product, because
So what are the current development projects going on right now in Boston area?
Yeah, so in Boston area, the largest project we're currently working on is our 585 Kendall project. It's a 600,000 square foot lab and office facility that's currently under construction. We're slated to complete the core shell of that facility in the second half of 2025. And it's fully leased to Takeda Pharmaceuticals. So it's a 600,000 square foot facility. They'll be commencing their tenant improvement work likely in the later half of next year. But that project is by far, I think, our largest local project, and we have a couple other projects we're working on as well. But that one's consuming a lot of our time. And I
It's a
know
massive project too, sure. Yeah.
it's a massive project, yes, one that we're very excited about, right in the heart of Kendall.
Okay. What about manufacturing? Are you interested in manufacturing biomed, or you are doing some already manufacturing projects or no?
So we have not focused in on manufacturing. It is a very different product set than traditional lab research environments. So as I mentioned before, a lot of the lab projects are really happening right in the urban core. And there's a cluster model to a traditional lab research facility in that urban environment. The manufacturing product is a very different product. Typically tends to be more suburban in nature, and tends to be a little bit more spread out than some of the lab facilities. So we definitely think it's absolutely a critical piece to the life science ecosystem, and really supports the life science industry generally. But to date, our focus has been on delivering product right in the core with that clustered portfolio based approach to the life science industry.
So now we'll come back to US. Now let us move to UK now.
Yep.
So when you look at the life sciences market here in Boston, which really, represents typical US market as well, and when you compare with the UK market, what is happening with life sciences industry in UK?
Yeah, so the life science industry in the UK is growing quite rapidly. So we actually very intentionally paired up Cambridge, UK with our Cambridge, Massachusetts team, because what we realized is a lot of the trends we're seeing in Cambridge, Mass translate over to Cambridge, UK. And so as an example, we delivered a project a few years ago that we delivered the interior fit out of the building on a speculative basis. And that was really kind of a novel concept at that particular point in time for Cambridge, UK. It's something we've been doing in Cambridge, Massachusetts for quite some time and really across our portfolio, but it was really a novel concept for Cambridge, UK, and was very well received. And the reason why we did that is because we saw the trend in Cambridge, UK, that the tenant demand base was smaller. It was groups that wanted to conserve cash. They needed a quick move-in date, and they didn't want to focus on the real estate. They wanted to focus on the science. And so that's a learning that we were able to translate from Cambridge, Mass, and bring it over to Cambridge, UK. So there's a lot of connection between the markets. I would say from a macro perspective, Cambridge, UK is doing quite well currently for life science tenant demand. I think it's a market where you didn't see the same influx of supply from new ownership entrants. It's a challenging place to develop. There's a lengthy permitting process. It takes a significant amount of time to bring new development to that market, and the projects are typically smaller region, and so you didn't really see the same influx of new supply.
What about mindset of the US life sciences entrepreneurs and UK life sciences entrepreneurs?
It's very different. It's interesting. I had a conversation with the CEO based out in Cambridge, UK, of a life science company there, and we were talking a bit about fundraising efforts for his company, and he had mentioned, raised $10 million, $20 million in the UK. If I went out and fundraised in Cambridge, Mass, I probably would have gotten 4 or 5 times the valuation and the funding. So I do think that the mentality between the markets is quite different. I would also say from a cultural perspective, if you're out with a group in the UK and they need 10,000 square feet of space, they take 10,000 square feet of space. Whereas in the States, for a long period of time, because of the low vacancy rates, that same group would have taken 15,000 square feet of space.
Sure. So now let's come back to US. So Boston is, of course, the largest portfolio of BioMed Realty here. What are the other core markets where the BioMed Realty has a presence in the US?
Yeah, so we are also focused heavily in South San Francisco. So we have our Gateway of Pacific project there. San Diego is another core market for us. We've got Seattle. And then we've got also Boulder, Colorado, which is a fairly new market for us over the last few years here. So really focused in on those core markets. I think we look for an environment where innovation can thrive, and where we think there's an ability for us to have scale in terms of having that platform and portfolio-based approach to life science. And so those regions naturally have some of those demand drivers present in those markets, and they're markets we think we can operate in effectively, just given our ability to drive scale.
So now, just how-to tips, for example, for say a life sciences startup had just got $50 million funding, and they said, okay, this is my idea, I have money enough, and I need a space. So how long time they will need, what are the steps they should take, and how you deal with that type of demand? What is your process?
Yeah, that's a really great question. I think what we're finding is it takes longer to develop spaces. So a tenant improvement build out that may have taken 9 months is now taking 15 months. So I think if you're a smaller company, you're primarily going to be focused on move-in ready spaces. I think it's really critical to find a great advisor, especially in a market like Boston, Cambridge, because a number of opportunities actually don't even hit the market. It could be a biotech company that may be downsizing and it may not even be public yet. And sometimes those are the best spaces that a user can get their hands on for a specific need. And so if you work with a broker or advisor that's very knowledgeable, that sits in this market, they'll know about those things, even if they're not necessarily publicly available. So I think that piece is really critical. I would also say for a smaller user, making sure that you know what you're signing up for, because life science facilities vary quite drastically. And you really do want to partner with a seasoned landlord that knows how to operate a facility, a life science facility, because it's obviously not, it's not very simple. You know,
Sure.
we always say if you're in an office building and the power goes out, your employees go home for the day and they work from home. If you're in a lab facility and the power goes out, you hope that you have a standby generator and that there's an on-site facilities and ops teams working on that effort, because you may have a freezer that's got decades of critical research in it. So you really don't want to play around with,
Hmm.
you know, working with an operator that may not have those safety protocols and those procedures in place. And the seasoned life science landlords, this is what we do all day, every day. But you know, you want to make sure you partner up with a credible owner that can operate that mission critical research facility. So those pieces are really, really critical. And as it stands today, given the current market conditions, if I was a smaller user, you should be demanding maximum flexibility. You know, if you in the past, if you raised an amount of funding to last you a couple of years, unfortunately, with market demands, you probably had to sign up for a 10-year lease because that's where the market was. Now you should meet, if you've got a couple of years of cash, you should negotiate for a couple of years, deal with some extension options, and try to maximize your flexibility with the facility. I think that's a smart way to move
So
forward.
I'm glad that this advice is coming from a landlord for shorter leases, right? And
Yeah.
so
Well,
no, that's I think that's a great idea for them. So now I have another question for you is if you look, after the COVID, there was a lot of nervousness in the market. The life sciences industry slowed down. There was so much demand for the architects, general contractors, and all for building and all those things. And now they're a little bit, not only slowed down, but seem to be struggling a little bit to gain that momentum. So the first
yeah.
question to you is how long it is going to take for the industry to come back the way it was going before? Is it going to happen or not? And then what do you think in the next 5 to 10 years? As far as I personally think that Boston Life Sciences is very safe, but still, I want to hear your opinion on that.
Yeah, I do think as we think about the Boston life science industry, you know, in terms of demand fundamentals and the fundamentals of this market, they're unmatched. You know,
Hmm.
you think about the scientific talent that's graduating out of institutions like MIT and Harvard, that it simply just can't be matched. And so I think when you talk to a lot of the C-level folks at these life science companies, they'll tell you that the number one thing they care about is attracting and retaining the best and the brightest talent, because the best and the brightest talent gets you to the research milestone, and that's really what propels and moves your company forward. And so for them, it's a non-negotiable. They need to be located in a region where they truly believe they can get the best talent, and Boston is certainly that spot. So I think from a big picture perspective, long term, Boston is very safe for life science, for the life science industry. It's naturally one of the most important industries for this region. I do think in the near term, as it relates to real estate, naturally the market fundamentals were so positive for so long, with record levels of fundraising, a very a very robust IPO market, you know, significant fundraising for a lot of these big pharmaceutical companies. So the industry was doing very well, which naturally meant more groups were building more product. So I think we are in a short-term period right now where we do have significant amount of supply relative to the tenant demand base. With that said, I think in a matter of 12 to 18 months, the market will start to stabilize. You know, the product, we're already seeing, you know, there's been sublease availability, it's on the market, the product's getting absorbed, it's moving forward. And so we will work through that sublease supply. We will work through the projects that are currently under construction. And as you can see, not a lot of people are building new projects right now unless the projects are pre-leased. So we will move through some of that sublease supply and the under construction supply, and I think it will get to a more
So
stable
Colin,
level.
that was going to be my next question is there anything under the plan or, BioMed is thinking about acquisitions, expansion? Are you looking for more development opportunities in this area?
Yeah, so we're focused, we very much believe in the Cambridge, Boston region. And as I mentioned, we're focused on that cluster model and that portfolio-based approach to the life science industry. So we are looking at continuing to look at opportunities across the Cambridge, Boston region. I think naturally in this environment, the review that we're doing of some of those opportunities and how we're looking at them, we're making more judgments on where we really want to be and what projects we want to focus on. But we are still continuing to look at growth within our core markets.
Now, again, this is my last question to you, since you mentioned the clusters.
Yep.
Boston Cambridge market is a very dynamic, very unique market. And even in this market, there are markets emerging within this market. For example, if you look at Watertown, it has really coming a big center for the life sciences companies there. And then you move further up, Somerville also has attracted some life sciences companies and things moving. So what is your take on these development of these new, is that this cluster development happening in other core markets or not? Are you seeing that?
Yeah, we're seeing that cluster theory across all of the core markets. I think it speaks to the way that life science companies operate. They really want to be close to each other. Really, it's an innovation industry. Life science companies like to be proximate to one another. They like to be proximate to tech companies, the talent base, the research institutions. So there's a number of demand drivers that really kind of pull everybody together into one clustered location. I think specifically with Boston, Cambridge, for a long period of time, Cambridge vacancy levels were below 5% for a very long period of time. And so naturally, groups were looking for areas that were proximate to that core that would be successful for life science companies as well. And I think, it's all a win for Massachusetts if we can get more life science companies to stay here. And we don't want to lose companies because they don't have the space to continue to perform their research. So moving further out from the core was absolutely critical, especially as the vacancy levels were so low in Cambridge. I think what we're seeing today is there is a flight back to quality and back to the core. And so the sub-markets that are most proximate to that core, I think, are going to be the best performing markets over the next 12 months or so here. But I do think it's been critical to branch out from the core.
So how are the rents holding up? Do you see any uptake, downward trend? What is happening with the rent?
Yeah, so what we're seeing is East Cambridge, right in the heart of the core of the market, rents have been pretty stable. What we're seeing in other markets is it's not necessarily rents pushing down. I will say sublease rents are all over the place because you're dealing with a number of tenants subleasing their space, but generally we're seeing concession packages around. That's really where the difference is. We're seeing longer free rent periods. We're seeing flexibility on the term lengths. So before it used to be you had to sign up for a 10-year deal. Now groups are willing to accept shorter term lengths. We are seeing a trend towards users focused on move-in ready spaces. So instead of having to put in a co-investment into a space, groups are really focused in on spaces that they can move in with a fairly low capital cost. So those are really the areas where it's trending more towards the tenant's favor at the current moment. But the way we look at it from the BioMed Realty perspective is we build for the industry, not for a specific tenant. So we can pivot pretty quickly. We know how to build interior spaces on a speculative basis, and we are able to put that capital commitment in because we know, we're not building it for a specific tenant, we're building it for the industry. And so if a tenant wants a 2-year term, we'll sign up for a 2-year term, and then we'll fill it with another group with pretty minimal downtime since we have that expertise in building the product. So that's really how we look at it with our portfolio-based lens.
So the flexibility is in making there. It always has been there for BioMed Realty.
Yeah, the flexibility is absolutely critical. I mean, it's the number one differentiator, I think, for seasoned life science owners versus the newer entrants, because you have to design a facility for life after tenant. It has to be built for the industry. And what we often do is we will design the space and show the tenant what the product looks like versus giving the tenant the pen, because you want spaces to be designed in a thoughtful way where they can be subdivided, and where you can accommodate a variety of program elements, not only for the landlord's benefit, but the tenant's benefit. You know, the science changes quite rapidly, and if they want to change a program element or engage in a new research experiment, they're going to wish that they had the flexibility. And so we're very intentional about the design. It's an area where we have the benefit of having all of our functions in-house. We have development, leasing, operations, facilities. We will sit at a table together for hours and work through a test fit plan collaboratively so that we can deliver the best end product. And I think for newer entrants to the life science real estate space, that part of it is really hard to get right because you don't have the experience, having learned some lessons from prior projects and putting those best practices to use.
Very good. Colleen, thank you so much for your time. Really learned so much, and all the best for BioMed Realty, and I'm sure we will touch base soon.